Democratic senators rolled up to the White House to hear from President Barack Obama that health care is at an end-of-year crossroads. His plea to his closest allies, his top domestic priorities too close to fail.
We simply cannot allow differences over individual elements of this plan to prevent us from meeting our responsibility to solve a long-standing and urgent problem for the American people.
For Obama, the price of accord is high, the apparent end of a public health insurance option, and even a talked about compromise, allowing over 55s to buy into Medicare. Yet with that, he seems to have won over independent Joe Lieberman and enough votes to thwart a filibuster.
And there's no other attempts to bring things like that in, then I'm going to be in a position where I can say, I'm getting toward that position where I can say what I've wanted to say all along. Then I'm ready to vote for health care reform.
But Lieberman enraged liberals who noted this September interview in which he backed a Medicare expansion.
And what I was proposing was that they have an option to buy into Medicare early.
Meantime, as Republicans thunder about a costly government health care takeover, Obama hopes for Senate passage by Christmas, saying there'll never be a better chance.
There are still disagreements that have to be ironed out. There is still work to be done in the next few days.
Of course, even if the president and his Democratic allies manage to muscle a plan through the Senate, their work is far from done. The House has passed a far different plan, and it includes a public option. So the president would still face the thankless job of reconciling House liberals demanding government health care with Senate moderates who won't accept it. Mark Smith, The Associated Press, the White House.